COVID-19 vaccination with fertility, there's still a lot of confusion going around. There's still a lot of worries going around. I noticed about this. And I know that recently government have been giving out vaccine like super fast, and many of you are getting vaccination already. I know, I see when I browse through Facebook, many of you already got your vaccine, and many of you already vaccinated or already got your date or going to get it soon. Very good. And I'm happy that all of you be vaccinated, and that is because we know that is the way to go. Alright, so, but there are many of you who are still very worried because you're trying to conceive. Okay, the few things you need to understand. Few concepts only. You just need to understand these few concepts. Number one, we know that COVID-19 vaccination does not affect fertility. There was a worry at one time. Some reports coming about sperm result lah, difficulty in getting pregnant lah. Number one, no such thing. There have never in the world where you have any vaccine that causes fertility problem. Okay? So such thing already doesn't sound real, sound like fake news. And true enough, finally, it has been proven to be fake news. So, number one, COVID vaccine does not cause you to have fertility issues in the future, yeah? So, don't worry. That is number one. Number two, you need to understand, the second principle you need to understand is when you get a vaccine and then only you know that you're pregnant, because you won't know that you're pregnant until the day that your period is supposed to come, right? Let's say your period is supposed to come next week or the following week, so you won't know. Or maybe your period only supposed to come in the next 3 to 5 days. You don't know, right? So when you get your vaccine and you find out you're pregnant a few days later, these things have happened thousands and thousands of times already. Many, everywhere. Malaysia, overseas, everywhere. And you must understand that overseas they started vaccination a lot earlier. And we already know that even if you know that you are pregnant after the vaccine, nothing happens in that pregnancy. No increase in chances of miscarriage or even abnormal baby. No difference. In fact, one of the research that came out, funny, the vaccine one, less miscarriage. The non-vaccine one, more miscarriage. So, no difference basically. No difference. So, next principle you need to understand, vaccination does not affect your pregnancy if you found out that you're pregnant after the vaccination. So, no worry. Just go for your vaccination. So some people may be like, no, your period is like supposed to come today, yesterday. Sometimes your period does come late by 1 day, 2 days, or 1 day, 2 days earlier. So your period is about then, and then you're supposed to go for your vaccine that day. So if you're not sure, just do a pregnancy test. Just do a pregnancy test. If you're positive, then you go to the vaccine center and inform that you're positive today. But if not, if you're negative, just go ahead and vaccinate. Alright? Because even if you find out that you're positive the week after, a few days later, we know it's safe. No issues. Just go for the vaccination. Alright? So that's the second fact that you need to know. Number 3 that you need to know is, if you are found pregnant, you cannot do your second dose until after 14 weeks. That's all. No problem. So if I get my vaccine today and I found out I'm pregnant next week, no issue. Second dose, just delay until 14 weeks. No problem. And now that all 3 vaccines are allowed to take for pregnancy, whatever vaccine you got before you're pregnant, you just take the second dose after 14 weeks. Because as I mentioned earlier in my first video on COVID vaccine in women, I mentioned already, based on the science, all these vaccines are safe for pregnancy. Because there's no live virus. It's all dead. It's all dead. So when it's dead, there's no problem at all. Just like a lot of the other vaccines that we take during pregnancy. I'm sure many of you who have been pregnant have been vaccinated with tetanus. The latest we give Tdap. Or in previously when we have influenza H1N1 outbreak, we gave influenza vaccine to all the pregnant women in 2019. So we always knew that pregnant women can vaccinate one. No big deal, chill. But of course, most of the time we don't just simply vaccinate everything on when you're pregnant. We tend to say we only vaccinate what's necessary. So tetanus was necessary. Influenza was necessary when there's an outbreak. And now we are all talking about Tdap being necessary in pregnancy as well. So vaccines that are necessary for pregnancy are necessary for pregnancy. And in all these vaccines that we take during pregnancy, we are not usually protecting just the mother, but usually the baby. Why we give tetanus to the mother when pregnancy? It's not for the mother, it's for the baby. Why we give Tdap is for the baby. Why we give influenza? Yes, it's for the mother, but it's also for the baby. Because we know when we vaccinate you, when you're pregnant, your baby will still be protected for the first 6 months to 1 year. So isn't that a good thing to get yourself vaccinated for COVID vaccine during pregnancy? Because we know that babies that are born will not be able to get the COVID vaccine. But babies that are born can still get COVID virus, can still get COVID infection. So if we were to vaccinate ourselves during pregnancy, then our baby will be safe as well. Because I notice a lot of mothers, they are very worried. They say, I'm going to give birth in this hospital. This hospital got a lot of COVID cases, especially government hospital. We know in Klang Valley, government hospital is filled with COVID cases. So they're so worried. They're worried that if they were to give birth in the government hospital, and then when they come out of the labor room, when they walk around in the hospital, going to the car park, what if there's so many COVID patients around me? Well, if you are vaccinated, at least you can be a bit assured that you are partially safe. Partially, so we know that even after vaccination, not everybody will be protected from the virus. So that is why we say after vaccination, you still need to wear your mask, But some of you, in fact, the majority of you are less likely to even get infected already. So you're very safe. So that is why vaccinating the pregnant women as a priority is one move by government that I totally agree and support. So if you are pregnant, please register for the vaccination. Okay, back to fertility. So what is the other issue we need to think about? So another thing we need to think about is those people who are going for fertility treatment. You want to go for IVF, you want to go for IUI, you want to go for all these treatment. Can I vaccinate and go for treatment at the same time? Oh, this question, no answer. Why? Because even the world bodies cannot agree. You have WHO writing something, you have another person writing another thing. There's so many guidelines out there. Why? The answer is very simple. We have no problems with you doing the vaccination during fertility treatment at all. Actually, there's no problem. You can go fertility treatment, you can have vaccination, there's no clash. But there's only that slight worry. Sometimes people worry. Worry about what? The common thing that everybody talk about, blood clot, blood clot, blood clot. Why? Because fertility treatment, all the injections you take during fertility treatment also increase your risk for blood clot. And COVID vaccine also increase your risk of blood clot. When you put both together, is your risk increased? No. No, but when you get a blood clot, we don't know due to what. If you get a blood clot, is it due to vaccine? Is it due to your fertility injection? Don't know. Let's not make things so complicated. If you go for vaccine, don't do IVF. If you go IVF, don't do vaccine. It's just for the hassle and the complication of not knowing what's happening. Better separate them up. But honestly, there is no need for that. So if you ask me my opinion, why certain bodies say go ahead and vaccinate, And certain world bodies will say, no. Actually, at the end of the day, it all depends only on one thing. Look at your country census. Look at your country COVID census. Do we have a lot of COVID cases? If not so bad, you could wait. Just do your IVF first, then vaccinate another day. No problem. Because pregnancy sometimes we also do not want to delay. Especially for people who are going for IVF, they have waited like for 5 years, 10 years. And when they reach their turn, you know, in certain places like government hospital, you have a turn, you know, your turn to do IVF. You get your turn, you don't just simply reject, don't know when you get again. So when you get your turn, you go. But vaccine or not, look at the country status. Not too bad. So if you're talking about 2-3 months ago, if you were to ask me this question, I would say, wait for your IVF lah. Or just vaccinate first, IVF delay, either one doesn't matter. But today, I wouldn't say that. I wouldn't say that. Because our country status is bad. We all know that our country status now is really bad. We need to get as many people vaccinated as fast as possible, especially if you're in KL, Selangor and Negeri Sembilan, right? You look at the census, these 3 states are the worst. Well done to Sarawak. Well done to Sarawak. Sarawak was quite bad, but they were very good in vaccinating everyone. We should always say congratulations to Sarawak who have vaccinated half the adult population. And you look at the cases, come down already. That's what we need. We need KL, Selangor and Negeri Sembilan to vaccinate half the adult population. KL is almost there already, but Selangor and Negeri Sembilan is still far, far away. So we hope that all of you will go vaccinate. If not, the situation doesn't improve, then life cannot get back to normal. I know everyone is suffering. Everyone is suffering. Everyone is cursing the government. We see that on social media every day. Curse the government, scold the government, scold the government. But we do our duties too. We register with My Sejahtera. When we get the date, we go. We go. We put down everything and we go. We do our job as well. Don't just scold the government. Because we need to get everyone vaccinated. Then only we are safe. So at this current moment, if you are doing your IVF, between IVF and vaccination, just go. There's no problem. There's no problem. It's just a blood clot thing. But honestly, I tell you blood clot, will you go for IVF? Everyone goes for IVF. That's why when I told you about the blood clot issue in my last video, I mentioned getting pregnant, you have so many more times of getting blood clot. 1 in 1,000 chance of getting blood clot by being pregnant. Would you get pregnant? You will. Going for IVF, your chances of blood clot is also high. Would you go? You will. Then why you go and worry about the vaccination? No need to worry. Just go for the vaccination. Because the chances of getting blood clot in the vaccination is so low. It's so low. If it's so much, you will hear it every day. Everyone already vaccinating. How many blood clot you hear? It's so rare. Okay? Like for example, everyone around me, my entire clinic is vaccinated. Except one last one, the pregnant, who is getting hers tomorrow and vaccinated. My whole family vaccinated, except my teenagers. Where got blood clot? So rare. Okay? So we do our duties. As a Malaysian, we want to help this pandemic. We want to help everyone else so that life can go back as usual. We want everybody to be able to get back to work, to be able to earn again, to have money again. We want all our life to come back again. We do our duty as a Malaysian. Register My Sejahtera. Go for the vaccination. Okay? Doctor, I had Lupron injection for endometriosis last 2 weeks. My COVID vaccination is on 20th of 7th. There shouldn't be any problem, right? Yep. No problem, just go. Okay, and I plan to conceive after this treatment. Hopefully all goes well. All the best to you, Jessie. And as I said, just go. If you want to really go and look, they will say again lah, Lupron lah, blood clot lah, vaccine lah, blood clot. Hiya. How many Lupron got blood clot? How many vaccine got blood clot? Honestly, I have not seen anyone on Lupron or Lupron injection with blood clot. Not even one. So even with COVID vaccine, I have not seen anyone that I know, my patient or my family or my staff that got blood clot because of vaccine. Nobody. So it is so rare. Go. Because the virus now is crazy. The virus is crazy. Delta strain is already in Malaysia. Go. Please go. So she said that I registered my Sejahtera but still haven't got any vaccination appointment yet. I'm in 29 weeks pregnancy. If I can get only one dose by 33 weeks, is there any issue? You don't have to worry about that because government know your due date. Government know who to call and who not to call. So as far as I know, recently all the people due date in August have all been called. But the question is 33 weeks or after 33 weeks, is it important? Let me tell you, how many weeks also can take? Why? First 14 weeks we say no lah. Okay, because baby early stage, a lot of organs still forming. We don't want to give you any jab in this type of stage. In all cases, whether medicine, jab, we tend to be more cautious in the first 14 weeks. 33 weeks, 35 weeks, 37 weeks, what's the problem getting the vaccine? No problem at all. But why? Do you know why they say last is 33 weeks? It's because one dose at 33, second dose at 36 ma. Then you go give birth ma. That's all. It's not that after 33 cannot take. After 33 can take. First dose 33, second dose 36. Then after that you go and give birth. Then can I take 34, 35? Can. But we have one problem. When the second dose after you give birth already, how? Then you cannot come lah. Maybe you are giving birth or just give birth, body still weak or have seizure, have wound, cannot get out of bed, how to go and vaccinate, right? And if you just had a delivery, your body very weak, even that your second dose will not work. So that is why we prefer you to take both doses, then only give birth. Understand? That is all. So you can take after 33 also, but only thing there's some logistic problem because when you take your first dose, then your second dose, you take that you're not around, then you can't get your second dose, then you're not fully protected, and then they give you appointment, you never come, then they forgot about you already. All those type of headache lah. So, but actually there's no problem. There's no problem. Okay, so when they give you, go. Okay, Sokchi, go. Even if it's after 33 weeks, go. And because I know some cases who got it after 33 weeks, because August due date is after 33 weeks, government still call, they still go. They still get themselves vaccinated. Just go. Alright? You get the date, you go. Because our cases is a lot. Unless you are staying like in Kelantan, Perak, what are the 5 states? Kelantan, Terengganu, Pahang, Perak, and Perlis. Yeah. If you are in all these safe states, maybe you don't go first, give birth and go. Don't make it so complicated. But if you are in like KL, Selangor, Negeri Sembilan, ayo, go. So many virus now everywhere. You must know our positivity rate is so high. Means that a lot of people with the virus that are not tested. So go, please, go. Because you going to the hospital to give birth also not safe. You better get yourself vaccinated. Even if 34 weeks, 35 weeks, go. Understand? Okay? You can still take the vaccination anytime after 33 weeks. But when you give birth and you get your second dose, we worry that your second dose will not work because your body is still weak. That is why we try to avoid that period of time. But with so many cases around, just go. Okay? Because after your first dose, 2 weeks after your first dose, you are already 70-80% protected if you get Pfizer, 50% protected if you get Sinovac and AZ. So please go. Okay? Hi doctor, if husband is taking Profortil capsule medicine, is vaccine will affect the medicine? No problem. You can take the medicine every day, you can vaccine every day. No relation, yeah? No relation. Nothing, all separate issue. Don't mix them out together. May I know what's the best time to get vaccinated after delivery? I'm 39 weeks now. Ideally, should be after your confinement, because as we say, your body should be back to normal. If you're still weak, the vaccine may not work. If you're back to normal, then only the vaccine will work. Because we don't just want to give you a vaccine, we want to give you a vaccine that works. So if you're still weak, your body may not be able to produce the reaction. So ideally, we should wait for 1 month. And there is also one more thing that I forgot to mention, that is vaccination. I mean, if you have gotten your first dose, what if you get pregnant in between? So the same is, if you do not want all the trouble, then you wait 3 weeks later, then get your second vaccine, then you're pregnant lah. Just make sure you don't get pregnant in that 3 weeks, because you can get pregnant, but only thing, if you are pregnant, then your second dose cannot take, you have to wait until 3 months. Not so ideal lah, because the way I describe it to my patients is, when 14 weeks later, government is just going to forget about you. That's what's going to happen. Because people don't take note. When you get your second dose, you don't want to go, you just say, I'm not going, and you just reject it. Why? You will say that because you are now pregnant, but they will not likely to remember you 14 weeks from now. So it's not like other vaccines, you go private, you just pay money. So then it's okay, I vaccinate today, then I know I'm pregnant, I just tell doctor, give me another appointment, now 14 weeks, then I go there for my second dose. But now we are depending on government and my Sejahtera to remember for you. It can be difficult. It's just like my staff who is pregnant. When she went, she knew she's pregnant. She informed government, we never got the date. Until at the end, she got it through, because she's pregnant now, everybody pregnant getting so she got it lah. But not through the frontliner vaccination phase. So sometimes when you don't want all this type of trouble, then it's better just don't get pregnant within that 3 weeks. Get your second dose done, then you get pregnant. That will be the best. Not much problem. JY Tan asks, will vaccine affect baby where the effect can only be seen few years later? I'm currently pregnant, second trimester. Theoretically, JY Tan, as I mentioned earlier, based on theory, based on the science behind the vaccine is made, the answer is no. It should not affect the baby. That is why so fast they can come up with all this approval, is because you just look at the theory behind it. There should not be a problem. Okay? If pregnant woman positive COVID, can she deliver normally? No. Malaysia SOP, COVID positive, all Caesar. Yeah? Unless when you reach hospital, there's no time to push you for Caesar. You reach straight away want to give birth, then it's normal birth. But if you knew that you're already COVID positive and you're admitted to hospital, like admitted for like few days, a week, and then suddenly you want to give birth, then it will be a Caesar. If you have complications of COVID infection, like you end up with category 3, 4, 5, usually we will Caesar you, okay? So don't get COVID infection when you're pregnant, because we can even Caesar you even prematurely. That is what typically happens. Can you explain why cannot deliver normally if COVID positive? Need to understand this. What's the complication? Few things. Number one is regarding the spread of the virus, because we know that in all infectious disease, even like something like HIV, like all these HIV, we do Caesar them, because we know that the baby inside you didn't get the virus. Because we notice that most babies do not get infected with COVID virus, even though the mother is positive. So the baby inside the amniotic sac, as long as it's still intact, is quite safe from the virus. But in natural birth, very often halfway the water bag will burst. And once the water bag bursts, that is when there's a lot of mixture of secretions between the mother and the baby, and that is when we worry that mother's blood may get into the baby and the baby gets infected with COVID. But in cesarean, because the time exposed, the moment we break the water bag, babies are usually out within a couple of seconds. And as a result of that, the exposure is very low. The chances of baby getting the virus from the mother is very low. So that's why we Caesar you if you're COVID positive. JY asked, I heard that there is a need to be vaccinated every year. Yes. How long would the vaccine last for the completed dose? We don't know, but we know one thing, that the immunity comes down with time. So we know it comes down with time, so it's going to be something we need to do every year. And this every year vaccination may be there for the rest of our life. Okay, one last thing. So as usual, whenever it's COVID, there's endless questions. So thanks for all your questions. I love questions because questions give me chance to understand what you really want. So before I end this video, as usual, I want to introduce to all of you, if you have missed any of my previous video, do visit my YouTube channel, Dr. Tan City Clinic. Okay, remember to subscribe, to like my videos, and switch on the notification button, yeah? Okay, so that's all for today, and stay tuned again next Sunday, same day, same time. Bye bye.